India has been badly hit by the coronavirus, with over 300,000 people reported as COVID positive on a daily basis. And so far, at the time of speaking, there has been over 220,000 deaths and counting. And since March 2020, there has been at least 20 million people who have been COVID positive, which makes this second to the US in terms of numbers. It's really heartbreaking to see people dying on the streets, outside of hospitals and in their home without any access to basic medical care. Reportedly, there's a severe shortage of hospital beds, oxygen, medicines, and basically India needs at least 2 million oxygen cylinders. And if you compare that to another COVID hit country like Brazil who needs 400,000 cylinders, you can put that into perspective. Now, I've been speaking to a lot of my Indian friends and medical colleagues to find out exactly why this is happening. I've been hearing about the class divide. So basically, you've got the rich and you've got the poor, but there's no actual middle class. So if you're rich, you can get access to private medical treatment, or if you can afford to go to a private hospital and pay for the treatment, you can get access to doctors, nurses, COVID medicines, oxygen that the poor cannot afford or get access to. I've also been told that you have to pay for COVID vaccines in India. Now, I did my own research on this. And those between the ages of 18 to 44 are expected to pay, as they're not under the priority group for vulnerable people. However, if you're from a low-income family, then the government has to provide free vaccinations. This varies from state to state, where it's free for everyone, or if you go to a private hospital, you have to pay. I've also been told that a figure of 200,000 deaths have been underestimated, and is actually 5 to 10 times more than the official figures. Now, this is all word of mouth. Another thing I've been told is that the cost of life-saving equipment like oxygen cylinders have quadrupled in price, which only the very rich can afford to buy, and some of these equipment and medicines are sold for extortionate prices in the black market. So I did some research for myself into the cost of oxygen cylinders. An oxygen cylinder, which is usually 6,000 to 10,000 rupees, so in pounds that's 58 to 97 pounds, would now cost 60,000 to 100,000 rupees, which is 580 pounds to 970 pounds. So that's way 10 times more than the original price. That is extortionate. That's ridiculous. Also, there are fake drugs for COVID treatments currently in the black market, but because people are so desperate to buy this medication, they're just buying this stuff thinking this would help. Now, India were doing quite well back in February. Numbers were going down to about 20,000 cases a day, which is still a lot, but if you bear in mind that India has 1.4 billion people, then you can put that into perspective. However, they became complacent. A lot of them were not social distancing, they were not wearing masks, and bear in mind, only 30 million of the 1.4 billion people had been fully vaccinated. So majority of the population had not had full vaccination. And despite the scientists' warnings about a new variant that was more contagious than the old COVID-19 variant, no one listened, not even the government listened, and now this has spread like wildfire to become a second wave. Also, there is the possibility that the current vaccines are not as effective against the new variant. Despite all this, there is no full national lockdown, and this might be due to the fact that the government is afraid of the economic impact on the society. So for those who are abroad, what can we do to help our brothers and our sisters? Regardless of ethnicity, religion or race, there should be compassion for others. I myself, as a Christian, the Bible says, love your neighbours as you love yourself. And in the book of 1 John, chapter 3, it says, if anyone has material possessions and sees a brother or sister in need, but has no pity on them, how can the love of God be in that person? Dear children, let us not love with words or speech, but with actions and in truth. So short of flying out there to help out, what can we do to contribute from here? Check out my description for links on Christian and non-Christian organizations that you can donate to help those in need in India. So you have the COVID-19 Emergency Appeal Fund, you have the Feed the Hungry Fund, and you have the Khalsa Aid International. Now, these are some of the organizations that are currently shipping out oxygen concentrators and cylinders, food and medicines that can help with those that need it in India. Please share this video as we can all help the people in India, and we can do the same for all other countries that are in need. So please, if you like this video, subscribe to my channel.